Hello, this is Talha, and I will be doing a case study presentation about my dad. So, for my case study, I chose my dad because he has a couple of illnesses that are commonly seen with other patients, as well as the medications he's taking that we've learned in class. He is diagnosed with type 2 diabetes and hypertension, and as you can see with the medications below, metformin, Jardiance, glipizide, and Arcobus are actually all used for his type 2 diabetes, and his lisinopril is for his hypertension. Um, the metformin works in a couple ways. It reduces glucose in the body that's absorbed from the food. It reduces glucose made in the liver and increases the body's response to insulin. Jardiance helps the patient with excreting excess sugar from the body through urination. Glipizide lowers blood glucose by causing the pancreas to produce insulin. And his Arcabos slows food digestion, which helps keep blood glucose from increasing. And then his lisinopril is for his hypertension. What learning needs did I discover and how did I teach my client regarding those needs? Some of the needs I discovered were his diet, which was very poor. I had to teach him that he needs to watch what he eats and how much he eats because it's very crucial on managing his diabetes. His smoking still hasn't stopped. He tells me he tries, and I believe he tries, but he still hasn't stopped. He definitely has improved from before. He used to smoke a lot, and now he doesn't as much, but the cessation needs to appear soon because smoking can cause a lot of damage. Physical activity as well. I tell him that he needs to get up. It takes just 30 minutes a day just to get out there, just do some laps around the house, and he does a lot of landscaping, but I don't think that's enough. I feel like he needs to be a little more physically active to maintain his diagnosis of type 2 as well as hypertension. I mean, all of these play a huge part in controlling his illnesses, so I had to tell him one by one that it starts with one and it leads to the other. His diet, his smoking, his physical activity, it's like a domino effect. One leads to the other. These all work together in a way to manage his type 2 diabetes. So how did the teaching session go and how did my client respond? So as I mentioned before, I sat down with him and I told him step by step what he needs to do, starting with his diet. He needs to be more careful. I mean, he is lactose intolerant as well, so it is kind of hard to have a proper diet when you're controlling the blood glucose as well as your lactose intolerance causing some other problems with it. So I taught him that he needs to just be more careful of what he eats and how much he eats and when he eats it because that's a crucial part of his diabetes. I also taught him that the smoking just needs to stop because like I said before, and I will tell him every day, every time I talk to him, that smoking will lead to other problems. Like, he's lucky he only has type 2. I mean, he's been smoking for how long? And thankfully, he doesn't have any other problems. But his smoking would drastically lead to other problems if he doesn't stop. And I told him about his physical activities as well. So how did he respond? He sat there and he nodded his head. He understood everything I was trying to say. He did respond well and appropriately. He did sit there and tell me that he is going to try to maintain his diet as well as his physical activity. He did take up some sports, so I think he said he plays tennis now, and he has bought an elliptical that is now set up at the house. So he does have physical activity now, and his diet is well controlled. He has this menu set up from my stepmom, so he has his diet properly checked as well. And then his smoking, he says he's trying, so that's all I can get from him. It's very hard, especially for the amount of time he's been smoking for. It's not something that just happens overnight. So he did give me the yes that he will try and the yes that he will give his best to stop smoking because he does understand that smoking is the worst for his body. So his response to all of my teachings was appropriate and well managed, and he does understand the consequences as well as the benefits of the teaching sessions that I provided for him. A couple of things that I learned while doing this assignment was that there have been some factors on why his diet is poor, why he continues to smoke, and why he doesn't. I mean, they're not like really big factors, but he does tell me that stress is one of them because financially, he's been working a lot, and one of his ways, unfortunately, coping with stress is smoking. Um, Also, family support. He does have a lot of family, but they don't currently live with him or near him. Most of his family is either across the country. So most of his family is in Florida or Canada or back in his home country. So he doesn't have a lot of family support. So there's no one really there besides us and his wife, um, that are trying to guide him through his illnesses. So those are a couple of things I've learned. Stress is a big one. That's one of the reasons why it's hard for him to stop smoking, because after a long day of work, or just in general, whenever he just needs to clear his mind because of the problems he is facing, he just has to smoke. And I get that, I understand it, but he also needs to realize that there needs to be other ways to manage your stress than smoking. And then family support, we are trying, me and my siblings, and then some of his family members, we are trying as well as we can to support him in guiding him through this, because we all understand, including my dad himself, that we can get through this as long as we have each other for support. So those are a couple of things that I've learned while doing this assignment.